have not been doing nearly enough testing, so we really don't know the extent of bird flu that's out there in humans.
A mutation in the bird flu virus sets off alarm bells for public health officials.
There are a lot of men that are walking around not necessarily overtly a loner, but feeling very lonely.
The epidemic of loneliness impacting men in America.
It's literally forcing you to just kind of sit in the present moment and not have racing thoughts and negative self-talk.
And how a regular meditation practice can improve your health in the new year. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with breaking news in the health world. The U.S. Surgeon General is calling for labels on alcohol warning about the risk of cancer, following mounting research and evidence. Dr. Vivek Murthy says consuming alcoholic beverages is the third leading preventable cause of cancer. The current warning label, in effect since 1988, warns alcohol should not be consumed during pregnancy, that it impairs your ability to drive a car or operate machinery, and may cause health problems. For decades, moderate drinking was said to help prevent heart attacks and strokes. But recent studies show it raises the risk of developing at least 7 types of cancer.
We are now pretty certain that any alcoholic consumption can be bad for you. The cancers that it primarily impacts are oral cancers, esophageal cancers, stomach, bowel, breast cancer. But it really not just cancer, it causes more than 200 different diseases in the body.
Surgeon General Murthy says about 20,000 people die every year from alcohol-related cancer cases. The power to change the label lies with Congress. There's been a wave of appreciation and remembrances for former President Jimmy Carter, who died December 29th at age 100. Among his accomplishments, the 39th president has a legacy in improving global public health. His nonprofit organization spent 5 decades working to eradicate guinea worm disease, a parasitic infection caused by consuming contaminated drinking water.
When we began with the guinea worm program here, there were over 20 million people who were affected. Now we're talking about 14 people in the entire world, 14 persons.
Carter also persuaded big pharmaceutical companies to donate drugs to treat river blindness, another parasitic disease transmitted by small flies in Africa, Latin America, and the Middle East.
The scale of the numbers of people who've been impacted, and especially poor people, generally disenfranchised people, is very, very remarkable.
Carter will lie in state at the U.S. Capitol before he's laid to rest at his home in Plains, Georgia. The Food and Drug Administration is now testing cheese made from raw cow's milk for potential bird flu contamination. At least 300 samples will be collected nationwide over the next 3 months. The search for the H5N1 virus is expanding after an outbreak in multiple states linked to raw milk and dairies. The virus is also showing up in raw pet food, killing at least 1 cat and infecting several more. So far, more than 60 people have contracted H5N1. Scientists say that's due to a mutation of the virus that affects humans more easily. On CBS's Face the Nation, former Baltimore Health Commissioner Dr. Leanna Wen said there's most certainly been an undercount of human cases.
I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not.
Thursday, the Biden administration announced it will significantly increase the money committed to ward off a potential bird flu outbreak in humans. The new year ushered in new state laws that could impact mental health for kids. A new Florida law now bans children under 14 from having social media accounts and requires parental consent for ages 14 and 15. Enforcement of that law has been paused due to a lawsuit. In Tennessee, a new law requires parental consent for young people to open social media accounts. Similarly, in Minnesota, a new law requires school districts to adopt a policy on the use of cell phones in schools by March. As CBS's Derek James reports, one nonprofit has gotten a jump start, working with students to find a healthy balance away from devices.
This group of students at Two Rivers High School meets 2 or 3 times a month. Notice that there isn't a single smartphone in sight. That's the point. They're part of a digital well-being club.
What's your relationship like with these?
So it's a really great piece of communication. at the same time, it's draining hours and it's wasting away time that I could be spending with family or on school or with friends.
The club partners with Live More, Screen Less, a nonprofit started by Catherine Myers, a former teacher of 25 years.
Our mission is, to continue to bring digital well-being forward, and then our vision is young people thriving in a digital age.
For over 5 years now, Live More, Screen Less has collaborated with community stakeholders to support young people. At Two Rivers, students host log-off lunches where devices go unused. At a recent leadership summit, club members had the ears of leaders from public health, education, government, and technology firms like Google.
We facilitated really good discussions about screen use and about actions that we can take.
These students initially wondered how an updated cell phone policy would impact them, but say it's working.
We felt more focused in class, that we didn't have the opportunity to be distracted by technology and like checking Snapchat, checking whatever it is.
I think this club keeps me accountable because as saying that I'm a large part of the club, I have to demonstrate that, and I can't be someone who's on my phone.
We started focusing really on high school students. We need to be at birth.
While she's seeing positive steps forward, Myers says more action is needed. Derek James, CBS News.
As the new year begins, about 80% of Americans are working on New Year's resolutions that focus on health, according to a Pew Research poll. Experts say new goals should be small, specific, and achievable, like walking more, preparing healthy snacks, drinking less alcohol, and prioritizing sleep. If you're looking to lose weight, a new study in the Journal of the American Medical Association found at least 2.5 hours of moderate to high intensity aerobic exercise per week may help lead to a meaningful decrease in weight, waist size, and body fat. CBS News medical contributor Dr. Celine Gounder joins CBS Mornings to explain.
So really, any kind of exercise can get you there. The question is how strenuous and for how long. So what this analysis found is that if you exercise for, let's say, 20 minutes a day, 7 days a week, or 30 minutes a day, 5 days a week, you will achieve significant weight loss. You also need to get your heart rate up high enough. So when they say moderate exercise, they're talking about getting to 50 to 70% of your maximum heart rate. Strenuous would be 70 to 85% of your maximum heart rate.
Getting enough exercise can be especially tough for women, according to a new study. CBS's Naomi Ruckham explains it's often because they spend so much of their time on others.
With 3 little boys at home, Jenny Morales sneaks in her workouts any way she can.
Do you like that?
But what used to be 5 one-hour workout classes a week has dwindled to mini sessions at home using free weights or the treadmill in the family office.
The baby and I are here for a little bit, a couple naps, feeding in between, lots of cleaning, and maybe a little small workout when he takes a 30-minute nap if I can get it in.
The struggle to find time is part of what experts are now recognizing as a gender gap in physical activity, in part due to the heavier load women carry for the family, whether they work outside the home or not.
Because you're a mom, and I think that some of those needs need to be met by you mostly.
In a recent study from Cedars-Sinai, only 33% of women met the standard for weekly aerobic exercise, compared to 43% of men.
We do know that at all ages, once you are an adult, and actually even during our childhood, women do less physical exercise than men.
While women have a tough time prioritizing their workouts, the irony is they may get more out of exercising than men.
For women compared to men, women got more bang for the buck, meaning that if women did half the exercise of men, they lived as long as men.
Experts say a short, light workout is better than nothing at all. Morales takes that to heart.
Your full hour, it may be in like little increments throughout the day, and then you get it done.
Putting her family first by keeping herself healthy too. Naomi Ruckham, CBS News.
More Americans hoping to lose weight this year may turn to GLP-1 weight loss drugs like Ozempic and Wegovy. Now doctors are increasingly prescribing them to adolescents. CBS's Janet Shamlian explains obesity in young people has tripled over the last 30 years.
15-year-old Jeremiah Jimenez weighed 350 pounds by the time he was 13. But after less than a year on the weight loss drug Wegovy, he lost 65. and hopes to drop 80 more.
What's that like?
It feels good. I just feel stronger because I've incorporated strength training as well. So I just feel empowered.
These are once-a-week injections?
Susie Jimenez says she talked to her son's doctor about whether it would be suitable for him after she dropped 70 pounds on the same type of medication.
He's turned into a different person, like his light has just been lit.
The number of prescriptions for young people for what's called GLP-1 weight loss medications is skyrocketing, from more than 8,000 a month in 2020 to more than 60,000 a month in 2023. They're FDA approved for adolescents 12 and older. More than 20% of adolescents are considered obese.
There's no off-ramp for these drugs that we know of yet. So putting an adolescent on them sort of means a lifetime of being on them.
Maybe, maybe not. I'm hoping over time we learn how the off-ramp works.
Dr. Stephanie Sisley, who doesn't treat Jimenez, is a pediatric endocrinologist who says while the medication's long-term effects are unknown, the health risks associated with obesity are undeniable. The biggest problem she sees are insurance rejections.
70% of our patients are not able to get the medication.
Jeremiah's prescription was $1,100 a month until his deductible was met. It has since dropped to $25.
Big breath. Chest out.
Jimenez now works out every day and says he feels great.
I finally have something that works for me. I don't have to drastically change my diet. I just eat in moderation.
I think for me, it's been the best decision that I have made for him because I've seen him struggle.
Alongside behavior changes, it can be a winning combination.
That's good work today.
For young people with a lot to lose. Janet Shamlian, CBS News.
Last one.
Austin.
Another top priority for goal setters this new year is to focus on better mental health. CBS's Jeff Wagner looks at how to develop a practice of mindfulness.
Dave Johnson is on his way to ease his mind. Inside his home is a calming space to meditate. Johnson has anxiety, a disorder that intensified during the COVID-19 pandemic. He works in public health.
Being completely overwhelmed by work and family and just feeling like there wasn't any way out.
Molly Peterson is the director of adult programs for Minnesota's National Alliance on Mental Illness.
I don't think that enough people are saying, I really want to improve my mental well-being in the new year. They want to do better in their job, they want to do better on their weight.
But specifically focusing on mental health can be easy and attainable.
As you mentioned meditation, and that's a great one because it's literally forcing you to just kind of sit in the present moment and not have racing thoughts and negative self-talk.
Here's some tips to get started in the new year. Use an app, as they can guide beginners on how to meditate. Create a space in your home to designate as the meditation area. Set an attainable goal for how often you'll do it. Lastly, find an accountability partner, either someone to meditate with you or gently remind you to stay on track.
It gives me the option of choosing, do I want to continue following anxiety thoughts, or do I want to do something else?
Ultimately, his recipe to better manage it included medication, changing therapists, and making meditation a more integral part of his life. Jeff Wagner, CBS News, Minneapolis.
After the break, strategies to beat the winter blues and a closer look at an epidemic of male loneliness. Welcome back. With the holidays now in the rearview mirror and 2.5 months of winter ahead, many Americans are feeling the effects of seasonal affective disorder. CBS's Jessica Guay illuminates us on how to take care of your mental health this season.
The colder, darker months of winter can make people feel gloomy and down.
Sadness, decreased energy, decreased interest in things.
Those are some of the symptoms of seasonal affective disorder, or SAD. It's a subtype of clinical depression that comes and goes in a seasonal pattern. The most common type is winter depression.
It is a real disorder, and people that are affected the most by the changes in light really suffer.
The winter blues are also real. It's just a less severe form of seasonal affective disorder. Allegheny Health Network psychiatrist Dr. Alicia Kaplan says the disorder can really interfere with daily functioning.
They may worry about it a lot in advance, knowing that they're not going to function as well, whether it's at work or there are home responsibilities.
Sitting by windows or getting out of the house can brighten your day. But Dr. Kaplan says people with SAD tend to hibernate, which can make symptoms worse. She tells her patients to plan activities ahead of time and make yourself accountable, because it can be hard to rely on motivation when you drop into winter depression.
If someone notices they're not really interested in things or not participating in family and other social interactions or outings.
Dr. Kaplan says that's when it is time to talk to your doctor. Treatments such as light therapy, medication, and psychotherapy can help. Jessica Guay, CBS News, Pittsburgh.
The winter months can exacerbate loneliness, something the U.S. Surgeon General now calls a national epidemic. CBS's Mark Strassman looks at one program specifically designed to help men build social connections.
God gave us a whole lot more testosterone than the other half of the world. We should enjoy it.
This is Everyman, a guys-only weekend getaway in the Berkshires of Massachusetts.
How you doing? Good to see you.
No drinking, no drugs, no phones. Roughly 50 men placing a premium on authenticity, opening up about struggles men often bury, like loneliness.
We can just be raw and real with each other.
We met Brad from Idaho. John's from Connecticut. Dan lives in Maine.
Have any of you struggled with loneliness? Yeah, I would say I'm struggling with it right now. And what does that loneliness feel like to you? Maybe fragility or insecurity. Does it hit you a lot? It's low-level consistent.
Loneliness is a poverty of the spirit.
What about you? Loneliness an issue?
I don't resonate with loneliness as much as I do my need for belonging.
Absolutely, I have experienced loneliness in the past.
If you weren't working at it, would loneliness come back to bite you?
I would be back where I was 2 years ago, which is when I'm home, I'm not present.
But it's not just regular guys exploring isolation. From Lenny Kravitz to Joe Rogan to Dwayne Johnson.
I know what it's like to be depressed, loneliness, multitude of things.
Even the most macho celebrities now talk about the richness of vulnerability.
As men, we've traditionally been put in a box and given a very small range to express our emotions.
Everyman co-founder Lucas Crump.
There are a lot of men that are walking around not necessarily overtly a loner, but feeling very lonely.
Loneliness can be rough on a man's health. It carries the same physical risks as smoking up to 15 cigarettes or having 6 alcoholic drinks every day. Think about that and this. Roughly 1 in 7 men say they have no close friendships.
Since we moved to Maine, making really close friends has been strangely hard.
In this crisis of connection, one of the Everyman messages, whatever you're feeling, share it.
Hey, I'm having a hard time in my marriage. And that's not something guys usually talk about. So you ask everybody, you're like, who else? And all the hands go up. It's like, oh. I'm not alone.
Their spouses or partners often encourage them to come here.
And there's something about letting our guard down and having fun with other guys that's hard to replace. It's a lot of work. Can be. But it can be fun at the same time. Absolutely.
Connection. It's like building a fire. Keeping it alive takes work, but the warmth is well worth it.
Is that going to work?
Mark Strassman in Sheffield, Massachusetts.
Coming up, running to find romance. We'll tell you about a new healthy dating trend, and we'll introduce you to 2 young friends bonded by their shared cancer diagnosis. Welcome back. Running clubs gained new traction in 2024, helping Americans get fit and make connections. Many singles say they're now ditching their dating apps and lacing up to find love. Here's CBS's Jared Hill.
Today is about meeting people in real life.
A freezing night isn't really ideal for running.
It's getting nice and close like penguins to stay warm.
But maybe conducive for this run club in New York.
We try to connect you with people who spend their time doing the same thing in the same place.
Steve Cole founded the Lunge dating app about a year ago and the Run Club not too long after for fitness-focused millennials and Gen Zers, groups who've gotten sick of swiping. In a recent Forbes Health One survey, 78% of respondents said they felt dating app burnouts sometimes, often, or always, and millennials most of all.
It's really nice to get to meet people who, even if they're not like your person, they share the same goal of dating in New York.
Any runner wearing black here is single and looking.
You get to learn a little bit more and see if that chemistry is actually there.
It's about mate selection at our core, and you get to see how someone operates in the clan.
Clinical psychologist Sabrina Romanoff focuses on people in their 20s and 30s. She says she's observed a number of factors increasingly turning the younger set away from dating apps.
There can be hours and hours spent messaging people and getting very little back, so people feel like they're not getting all the investment that they're putting into these apps.
As more people search for in-person connections, the dating app world has taken notice. Tinder has partnered to host in-person parties. Others, like Time Left, are connecting strangers for a meal. After her first time hitting the road with Lunge, Sophie Dandrin was on a mission at their post-run mixer.
I came here, I was like, I'm gonna wear black and maybe I'll meet somebody, I don't know.
Modern matchmaking through good old-fashioned socialization. Jared Hill, CBS News, New York.
Finally this half hour, two young boys who share a special connection. They became friends while battling the same type of cancer and then undergoing the same ultra-rare surgery. CBS's Danya Backus has their story.
I'm better at sports.
Okay, better at sports.
He's better. I don't do sports.
Competition between 11-year-old Noah and 10-year-old Wally helps to keep them going on days like this when they have physical therapy.
Oh.
The two forged a unique bond, meeting at Children's Hospital Los Angeles as they were undergoing treatment for osteosarcoma, a rare and aggressive bone cancer that accounts for about 3% of all childhood cancers.
Treatment for it is pretty intensive. Kids require, somewhere between 6 to 9 months of chemotherapy and usually a big surgery.
The surgery Noah and Wally had is called rotationplasty, which with a prosthesis turns the ankle joint into the knee joint. Dr. Alex Christ is the boys' orthopedic oncologist.
We remove that part of the leg with the tumor. We keep just the nerves and blood vessels that go down to the distal part of the leg. And we actually put the leg on 180 degrees backwards. So the foot is actually pointing backwards.
Noah and Wally had their surgeries 2 weeks apart. While cosmetically challenging, rotationplasty prevents the need for more surgeries as the boys grow. Their parents leaning on each other as they navigate the extremely rare cancer, even rarer surgery and treatments.
What are the odds for them meeting? They have the same diagnosis and same type of surgery.
It's good to talk to someone who's going through something, the same thing you're going through. I mean, the exact same thing we're going through.
A camaraderie that extends from patients to parents, bonded by the journey to becoming cancer-free. Danya Backus, CBS News, Los Angeles.
The healing power of friendship. That's this week's Eye on Health. I'm Bradley Blackburn. Thanks for joining us, and be well.